So as Peter said, we know the behaviours we need to undertake to actually avoid dental caries, and primarily it's about brushing twice a day with a fluoride toothpaste and reducing the amount and frequency of sugar. And it sounds quite simple when you say that, but actually when you really think about these behaviours and think about all the individual, interpersonal and social and environmental factors that influence these behaviours, they're incredibly complex. The good thing is that we can handle complex behaviours, so the MRC has guidance on how to develop complex interventions. And we've utilised this thoroughly to develop our interventions. We've undertaken a great deal of research to really understand the needs and the problems faced by families with young children and what they want to address this. And we've also undertaken this research with dental teams, the community, everyone. We've spoke to everyone who will speak to us. So we've undertaken a systematic review, qualitative interviews with parents and from deprived areas, and we've put this all into a robust scientific method called intervention mapping to develop a generic intervention. But first, to really understand the problem, we needed to find out what are the barriers and facilitators, what is getting in the way of translating guidance into practice. So, I'd like you to basically shout at me, what is it? What do you think are the barriers to parents looking after their children's oral health? Yeah, sure. Time, yeah. We live busy lives, lots of competing demands, lots of competing priorities. Where do you find the time, especially if you've got that school run, you just need to get everyone out, or at bedtime, it's a rush, everyone's tired, you just want to get them into bed and have an easy night. That's fantastic, thank you. Anything else? Grandparents. Good one. So yes, grandparents can be any sugar, yes, because it's kind of seen as their role to spoil children, stuff like that. So my daughter's with my mum and dad today. I'm pretty sure she's probably had a biscuit by now, maybe two, if I'm honest. But yeah, and it can be anyone who looks after children. So it could be if your children are looked after by other family members or friends, or even childminders, like having everyone else on board. Do they know about, controlling sugar intake? Do they know to brush their children's teeth if, it didn't happen on a morning? Or do they do it before you pick them up on a night? So fantastic, thank you. Anything else?
Parents' behaviour.
Parents' behaviour?
Yeah. Themselves experiencing phobia, not wanting to go into, so they translate the behaviour to the children.
Yeah, emotion is a really key factor, and it can kind of work both ways. It can be so emotional that you're so scared that you just don't kind of approach that topic at all, or it can work the other way, that you're so scared because you've had problems yourself that you're more determined. So it's a really interesting one that can act as a barrier and a facilitator. Fantastic, thank you. Anything else? Money, yes. Cost is always an issue. If you go to a supermarket, there's a million types of toothpaste and toothbrush. Which one do you buy? Do you buy the one that's most expensive, or do you buy the smart brand? Which works better? Do you go for an electric? Do you go for a manual? And then food, lots of sugary food that's cheap and easily accessible. Fantastic. Anything else? Nutrition. Yeah, so nutrition of the family, it might be a family norm that they all have poor nutrition, and it just carries on. Okay, so I'll wrap it up there, but as you can see from around the room, we've picked up lots of different barriers to looking after children's oral health. And actually really glad you did it. None of you actually said knowledge. And I'd agree with you. Knowledge is, important to some extent. You don't know what you don't know, but actually, it's all these other barriers that get in the way. When we undertook our systematic review and our qualitative interviews, the issues that you've mentioned came up time and time again. And the idea was, it's actually not so much about knowing what to do. Actually, people had quite good knowledge. It's about how to do it. And all these factors get in the way. And so we applied this to develop a generic intervention, and so this looks very complicated, but please bear with it. It's just a logic model of all the things that influence this behaviour. So ultimately what I want you to take away from this, if anything, is to actually change behaviour and achieve our outcome of reducing dental caries, you have to be motivated. if parents are not motivated to look after their children's oral health, they just don't see the importance of it, it's never going to happen. There's no point going into the how if you don't understand why you should be doing something. So that's a key message. But the thing is, our motivation is influenced by all the factors that you've mentioned at all these different levels. So it's not just about the individual, it's about that interpersonal level, so parent and child, so it immediately involves more than one person. The environment, the social context, and also the community and the organisation, so people like yourselves. Talking of the community, one of my favourite parts of my job is talking to the community, and we really wanted to explore what their needs were and what they wanted from an intervention. And what they said was that they wanted to start early. It was about developing good habits from the outset, rather than trying to go back and correct bad habits, which is much more difficult. They wanted any intervention to be fun and interactive, user-friendly, and really draw on parents' own experiences to develop their own solutions to the barriers they faced. And what they wanted was for the intervention to be delivered by the existing workforce, to really utilise the skills we already have. From all this underpinning work, we've developed a number of interventions that try to tackle as many of these barriers as possible, and they all have varying delivery vehicles. I'm not going to talk to you about them all today, but please, if you have any questions, please feel free to ask us. The only one I'm going to talk about in a little bit more detail is habit. So habit is a health visitor-based intervention. So at the 9 to 12 month developmental review, all health visitors have to discuss oral health. And we've done some work for with health visitors, and what we found was actually they didn't receive any mandatory or standardised training on how to have this oral health conversation with parents at this review. So we've really to co-develop this intervention, which at the heart of it focuses on that, why is this important, why is oral health important, and then moves on to that how. So we're following that whole idea of motivation is key first. So this intervention is a number of resources, tackling all the key barriers that we've just discussed. So as you can see here, the idea of importance, knowledge, skills, behavioural management. One of the things that didn't come up actually sometimes toddlers can be quite tricky trying to brush their teeth, or they can kick off if they really want that chocolate bar. So some stuff on diet and also the wider social influences. There are a range of digital and print-based resources. So this comes from the website, and there are videos that match all these key barriers. Should we play a little bit of the video, or are we going to cut it?
Yeah, let's play a little bit.
We'll play a little bit of the video just so you can have a little flavour of what they look like. Oh, it's not working.
Try one more time.
One more time.
You're tapping or not?
I'm tapping and it's just not happening.
Oh!
Oh. Oh, there we go, the magic of technology.
So you're both pressing on the same time, cancelling each other.
We're a professional outfit.
We all want to make sure we brush our baby's teeth properly. As setting up these habits is one of the most important things we can do for them to prevent decay. Unfortunately, babies don't always like having their teeth brushed, which can sometimes make it quite a challenge. It is normal for babies to have good and bad toothbrushing days, as resisting and seeking independence is part of their development.
Now kids didn't enjoy brushing teeth, but as the months went on, they started to enjoy it better.
I'm very, very fortunate that my daughter actually points out the toothbrush and gets excited about the toothbrush. She's not so keen once it goes in the mouth, but she's very interested in telling me where it is, and she wants to me to put the toothpaste on and put it by there. She's not so keen on the brushing. We do have it's very easy to get to the point of brushing the teeth.
There's a lot of screaming and kicking and
it off there, but that just gives you a flavour of what we've created. I'd like to point out as well, these are all real people. They're not actors, they're real families in our community that have helped us and that have just talked with us. So nothing is staged. These are real people with their real stories. So you can access them through the website, so parents have access to this at any time. It's freely available and they can access it as many times as they want. In terms of the actual health visit, it's guided by a small credit card sized leaflet that also covers all of these key barriers, and it isn't a leaflet giving exercise. The leaflet does not replace the conversation. So it's still about having a good oral health conversation between the health visitor and the parents, but that acts as kind of a framework and a guide, and it's something for the parents to refer to, and it has the website on and everything like that. We worked with Health Visit Earth to co-develop the intervention, and they helped us develop this protocol of how they would have their oral health conversation and how they would deliver the intervention. It's very simple, but very effective. They also thought it would be incredibly important to demonstrate good toothbrushing, and so they had these lovely plastic teeth and toothbrush that they would go and they would show parents how to brush teeth. And a key part was at the back of the leaflet, and this is an action plan. So together with the parent, the health visitor could help them figure out what were their key issues and what they really wanted to target over the upcoming months, and detail how they were going to tackle that issue. We have just finished our early phase study of habit. We've had our dissemination event, but we're now pulling together all those results and hopefully look out for in the future us spreading those findings. But initially they are looking very, very positive.